CD123 is expressed frequently in AML, including leukemia stem cells, and flotetuzumab is an investigational bispecific molecule that co-engages T cells with tumors that express CD123 and result in redirect T cells to kill tumor cells. And the phase 1 part of the study was completed, and now the study is enrolling patients on the expansion cohort. So in the flotetuzumab study, we're presenting some interim data from the ongoing study for patients treated at the recommended phase 2 study, which is the 500 nanogram per kilogram per day. And it's given as a continuous infusion. And inclusion criteria in our analysis, including patient with primary induction failure defined as refractory to 2 cycles of cytarabine-based chemo, or 2 but less than 5 cycles of venetoclax-based combination. And we also included early relapse leukemia, which defined first relapse happened within 6 months. And the primary objective was complete response. Patient characteristics on the study, we had 44 patients with median age of 63.5. The majority were primary induction failure, 61%, and the majority were due to refractory to cytarabine-based regimens. We had 40% early relapse disease, and the median duration of CR1 was close to 3 months. And the majority of patients had adverse risk and intermediate risk ELN risk stratification. And the median number of prior lines of therapy was 2. In this study, we show that almost all patients, they developed CRS, but all except 1 were grade 1 and 2. And most of the CRS happened in the first 2 weeks of starting the therapy, especially in the first week as we escalate the dose of flotetuzumab every day for the first 7 days. And this allowed patients who reach the maximum dose to be discharged by day 8. We have seen few brief transient neurotoxicity with flotetuzumab, mainly confusion, but they only last for 1 to 2 days, and they were fully reversible either on holding the drug or given dexamethasone. Over half of the patients treated with flotetuzumab, they responded, and they achieved some reduction in blast. The composite CR, CRI, CRH was 32%, including 37% in primary induction failure and 23.5% in early relapse AML. If we restrict analysis to CR and CRH, the CR/CRH rate was 25%, but was up to 33% in primary induction failure AML. We had additional 3 patients achieving MLFS. These responses were meaningful as 8 out of 14 patients who achieved composite CR, they were able successfully to transition to curative allogeneic stem cell transplant. And we have shown that patients with TP53 mutated AML, they have good response to flotetuzumab, as the majority were responders, and several patients of them, they were able successfully to proceed with transplant. The median duration of response was just over 8 months, and the median duration of overall survival was 10.7 months. So we conclude that flotetuzumab treatment in AML show manageable safety profile, manageable CRS, and infrequent neurological toxicity. Only 1 patient developed grade 3 CRS in this cohort. Treatment is tolerable with a required minimum 8 days inpatient hospitalization. Flotetuzumab demonstrated encouraging activity in patients with primary induction failure and early relapse AML, a population with poor prognosis and high unmet need, with 32% achieving some kind of complete remission. And over half of these patients were able successfully to proceed with transplant. And this is compared to historical control data that shows the CR/CRH rate in this cohort is with salvage therapy is around 5 to 12%.